My name is Lasya. I'm from Marquette.
I'm Cheryl. I'm also from Marquette.
I'm Shaily, and I'm also a senior at Marquette High School.
So I guess I'll get started. Can you tell us a little bit about like your education, like where you did your undergrad, where you went to med school and all of that?
Yeah, absolutely. So I went to undergrad at Cornell University in upstate New York, and I got a degree in actually German languages and literature and in neurobiology and behavior. Doubled up on that. And then I went to medical school at Washington University in St. Louis. And after I was done with medical school at WashU, I did a residency and then a fellowship at WashU as well.
So, what types of patients do you typically work with?
So I see kiddos from as young as 6 at the transgender clinic at WashU, which is one of the places that I work, up through about 30s sometimes. I spend half my time on the Danforth campus at WashU as a health physician there. And so I see graduate students there as well.
Do you have any significant research or anything that you want to tell us about or want to share?
Yeah, so one of the things that I really enjoy doing is finding ways that improving patient health can dovetail with research opportunities so that it's really clinically applicable. So I'm working on a research project right now with the other folks at the Transgender Center, looking at the relationship between gender identity and weight and eating disorder propensity. So we have a piece that is in press right now related to that.
That's awesome. So, with the COVID-19 pandemic, how has the mental health of the patients you see and patients in general changed, and how do we mitigate the effects of it?
Yeah, so one thing that I noticed initially, it seemed like some of my more socially anxious patients, so those folks that are really worried about being around other people or worried that they're going to make a mistake in a public atmosphere or something like that, were feeling slightly better with some of the safer at home orders. But as time has gone on, pretty much everyone I see has had some increase in their depression or in their anxiety. I've also noticed that my patients with OCD are struggling a lot more, obviously, particularly the folks that have worries about contamination or germs. And so we've been navigating ways to take realistic steps to stay safe while not falling into the trap of reinforcing obsessions and compulsions. I would be really surprised, honestly, if any human being with a mental health condition or not wasn't having a hard time on planet Earth right now. So I think it's important for all of us to be really gentle with ourselves and with one another. And that this is really a time for us to be showing ourselves and our loved ones as much compassion as possible as we're working through this trauma.
So, why is it important to have mental health professionals that are specific for the LGBTQ community?
Yeah, so I think ideally, um, every person would feel comfortable, every person who's a health professional would feel comfortable treating LGBTQ patients because here's the secret. If you are in healthcare, you're seeing LGBTQ patients whether you know it or not, right? But I think it's important for us to be aware and providing safe spaces for some of the special issues that come up for folks. So, as I'm working with teenagers who are going through their transition, it's important that I have knowledge about what it looks like to go through social transition, to go through medical transition, if that's something someone is interested in. It's important to have folks that are really affirming and supportive of that process because we know that one of the best predictors of outcomes for folks is that they have a supportive adult in their life, usually a parent, but it can be a healthcare provider too. So it's important that we have folks that are not only aware of those issues, but also able to be supportive and affirming.
All right. And so just building onto that a little bit more, like how do you specifically help young people who are struggling with their sexuality or their gender identity? And also how can we, as allies, help LGBTQ youth and teens that you work with?
Yeah, great question. So I would say the main thing that I do is help folks explore and pick apart the complex people that they are, right? So for a lot of folks, struggling with gender identity or sexual orientation can contribute to anxiety and depression. Bullying or being rejected by family can contribute to that too. And so it's important to be aware of the ways that those things interact. At the same time, there are a lot of folks who are just trans and anxious or lesbian and anxious, and being able to not blame everything on gender identity or sexual orientation exploration is important too. So going through that with patients, going through that with parents, and encouraging parents especially to be supportive is really important. As I said, having supportive adults is one of the biggest predictors of how someone's going to do, how likely someone who is LGBTQ is going to be to go on and have issues with depression or anxiety or thoughts of suicide or those things. Is supportive in that same way. So we know that exposure to bullying at school, for instance, is a really big risk factor for folks to have mental health issues or thoughts of suicide. And so if you can be not just a bystander, but an upstander when you see something like that happening and say, hey, that's not cool, that's not okay, and be supportive to your friends or yourself if you're going through a process of gender or sexual identity exploration, you'll really contribute to the health of everyone at your school.
That's cool. So, as students, what's a way that we can help students struggling with gender identity? How can we help them open up or speak to us about the issues that they're facing?
My recommendation would be that sort of what I tell everyone is make it clear that you're a safe person to talk to. That can be as simple as when you're introducing yourself in classes or to someone new, saying, for instance, I say, hey, I'm Dr. G, because Geidinghagen is really long, and I use she, her pronouns. Or having buttons that display your pronouns, even if you're cis, just normalizing that folks give their pronouns. Or talking about being an ally or having visible markers of being an ally on your backpack or on your locker. Things like that can be really important.
Sheryl, Lasya, do you guys have anything else to add or do you want to ask Dr. G?
I think that's all the questions that I have. Yeah.
Yeah. If you have anything to add, that you feel we should know about COVID-19 or the patients that you work with, then you can, if you have something else to add, please do that. Otherwise, I think we're pretty much done.
Awesome. Well, it was great to talk with you. And I'm really glad that you guys are taking the steps to support your peers and taking the steps to sort of destigmatize mental health, because I talk a lot about stigma really being like a pathogen almost. I think everyone has become so aware of COVID-19 and everyone is taking these steps, obviously appropriately, to help control spread and to help stay safe. I think it's important when we're talking about mental health in the same way to really fight stigma And while we're still learning a lot about COVID and how to control that and treat that, we really know a lot about how to control and treat stigma for mental health conditions, right? It's folks being willing to be open, being willing to have these conversations that you guys are having. So congratulations to you on that.
Thank you. And thank you for joining us. We definitely learned a lot. So yeah, thank you.
Yeah, thank you so much. It was so nice talking to you, and thank you for your time.
All right. Thanks so much.